Dr. Stolworthy, Logan Regional is a Level 3 trauma center for stroke recipients too. Tell me a little bit about that.
It's a Level 3 trauma center, the only trauma center in the Valley, and it's also a stroke receiving facility, which means it's in a network with other stroke hospitals to provide the best care possible for anybody suffering from a stroke.
And what may be some of the signs of a stroke that people out there may not be aware of?
Strokes you can have a number of different signs. Some of the most common signs are inability to speak, confusion. It can also be somnolence, people are really sleepy, not acting themselves. A couple of other symptoms would be like visual changes, numbness or weakness like on one side, difficulty walking, their balance is off, they're dizzy, memory issues. There's a number of different experiences or symptoms that people can have with a stroke.
And as a stroke recipient, hospital, what exactly does that entail for you guys to diagnose someone?
So what that means is when somebody comes in with stroke symptoms, everything focuses on getting that person diagnosed as fast as possible so an intervention can occur if needs be. We have medicines that we can actually, depending on the type of stroke, give. Those medicines can dissolve clots that could be causing the stroke. So what happens is basically we mobilize a team of different individuals, radiology technicians, radiologists. We get a number of other ancillary groups that come and help us, like the laboratory, and we just expedite everything. We get them to the scanner as fast as possible, and we also get a diagnosis really quick.
So timing is very
It's
important.
very critical. In order to give this medicine that dissolves stroke clots, you have to give it within 3 to 4.5 hours. A lot of people, they're really not sure what's going on. They come in later, and so the clock is ticking when they get here. A lot of the times we have to get it done within an hour.
So it's very important if you start having these symptoms to get in here as quickly as possible.
Exactly. The sooner the better.
Also goes for heart attacks.
Correct.
Tell me a little bit about, I mean, we all know some symptoms of heart attacks, your arm, shortness of breath, but maybe there's some people that aren't aware of some of these.
In women, it's a lot more different. A lot of women will have shortness of breath as their symptoms. The classic symptoms for a heart attack is pressure or tightness in the chest, especially if it radiates to the arm, and then shortness of breath. They also have other symptoms with that, like sweating. They feel nauseated. They feel their heart beating funny or irregular. Symptoms that they can also have, though, is just jaw pain.
Jaw pain, really?
Jaw or neck pain. They'll also get pain in their back sometimes, and that's the only symptoms that some people come in with a heart attack.
And those are very, very important signs to look for.
Very important signs.
And why would your jaw hurt? That's something that I would not think of.
It's the innervation of the body. Just for example, like when you drink something cold, you get a really bad headache. With heart pain, there's the innervation that goes to the shoulder, also goes to the heart, to the neck, portions of the neck, to the heart, as well as to the stomach. So people can have those kind of symptoms just because of something called referred pain.
I see. So how many usually do people come in here a day with having some of these symptoms? That
we see chest pain frequently, and we also see a lot of stroke symptoms. Now, a lot of people come in and are really reassured because they don't have a stroke. They have conditions like vertigo, or they're dehydrated, or they're sick.
That they come
it's very important. It's very important, and it's amazing because stroke can affect a lot of different people. Stroke can affect the youngest people.
Yes, so it's not just necessarily from the old elderly, it's all the way down to what age do you see?
We've had 20-year-olds with strokes. Just various conditions that they were born with make them susceptible.
Very true. Well, if you have symptoms of these sorts, you guys are a Level 3 trauma place and also a stroke recipient place to come. And you send them off somewhere else if they're having this?
It depends. If they have a bleeding stroke, we most certainly do. We don't have neurosurgery here. Certain interventions for heart, like stenting and open heart surgery, is done at another facility too. And people can choose what other facility they go to.
Well, thank you so much, Dr. Ryan Stolworthy. We're here at the Logan Regional ER room, and thank you so much for all that information. It's important if you have these symptoms to come in right away.
Thank you very much.